Your body speaks to you in ways you might not always notice. Every ache, every discomfort could be a signal, telling you something important about your health. When it comes to aging, one area that deserves special attention is prostate health. As men age, the risk of prostate issues increases, but many don't pay attention to the early signs. Ignoring them could lead to bigger problems down the road. Prostate health is more than just a physical concern. It's connected to overall well-being and vitality. If you're not paying attention to the changes your body is signaling, you might miss out on simple steps that could make a big difference in your health. It's easy to overlook, but the more you understand about the warning signs, the better you can protect yourself. In this video, we'll be looking at what these signals mean and why it's important to take them seriously. Whether you're dealing with discomfort or just want to stay ahead of potential health issues, knowing when to act can make all the difference. Prostate health is something no one should ignore, and it's never too early to start being proactive. So, if you want to learn more about how to take charge of your prostate health and avoid future complications, don't forget to hit that subscribe button. Stay tuned as we uncover what every man needs to know to stay healthy and feel his best. Ignoring the signals your body gives you can be dangerous, especially when it comes to your health. Sometimes, the smallest discomforts or changes are your body's way of telling you something isn't quite right. When it comes to prostate health, many men overlook these signs, thinking they're just a normal part of aging. However, dismissing these early warning signs can lead to serious health issues later on. The prostate plays a key role in your overall health, and when it's not functioning properly, it can affect many aspects of your life. If you notice symptoms like frequent urination, trouble starting or stopping urination, or discomfort in the pelvic area, don't ignore them. These could be signs that something is wrong with your prostate. While these symptoms might seem small at first, they can be a signal of a condition like Benign Prostatic Hyperplasia, BPH, a common issue as men get older. BPH is a condition where the prostate becomes enlarged, pressing against the urethra and affecting the flow of urine. When left untreated, it can cause a number of problems, including kidney damage, bladder issues, and even urinary tract infections. BPH can also lead to sleep disruptions and emotional stress, as the constant need to urinate can interfere with daily life. Aside from physical problems, neglecting prostate health can also impact your emotional well-being. Dealing with discomfort, frequent trips to the bathroom, and the stress of not knowing what's wrong can lead to anxiety and frustration. Many men who ignore these early signs end up feeling isolated or embarrassed, especially if they don't talk about their symptoms. The emotional toll of living with untreated prostate issues can be significant, affecting your mood and quality of life. Ignoring body signals doesn't just affect your physical health. It can also have a long-term effect on your mental and emotional health. When the prostate is not well, it can lead to feelings of helplessness, anxiety about potential health risks, and even depression. These are not just side effects of an untreated condition. They are direct results of letting something go unaddressed for too long. The good news is that taking action early can make a huge difference. When symptoms like those associated with BPH are addressed early, the condition can often be managed with medication or simple lifestyle changes. Ignoring them, on the other hand, increases the risk of complications that could have been prevented with early intervention. Remember, the prostate is just one part of your overall health, but it plays a major role in your well-being. Taking care of it early means better physical, emotional, and mental health in the long run. Don't wait until it becomes a bigger problem. Pay attention to the signals your body is sending, and don't be afraid to seek medical help when something doesn't feel right. Poor hydration habits can lead to several health issues, and one area where dehydration can have a serious impact is prostate health. Many people don't realize the connection between the amount of liquid they drink and the function of their prostate. Reducing fluid intake might seem like a simple way to avoid trips to the bathroom, but it can actually harm your prostate over time. When you don't drink enough water, your body starts to become dehydrated. Dehydration can affect many parts of your body, including the prostate. Without enough water, the urine becomes more concentrated, which can irritate the bladder and prostate. This irritation can lead to frequent urination, discomfort, and an increased risk of urinary tract infections. For those with existing prostate issues, dehydration can worsen symptoms and make it harder to manage the condition. Consistent hydration is key to maintaining prostate health. Drinking enough water helps flush toxins from your system and ensures that your urinary tract functions properly. Hydration also keeps the prostate lubricated and reduces the risk of swelling or inflammation. When your body is properly hydrated, it works more efficiently, and the risk of developing prostate problems is lower. Maintaining proper hydration doesn't mean you have to drink gallons of water every day, but it's important to keep a steady intake. A good rule of thumb is to drink at least 8 glasses of water per day, but your body's needs may vary depending on your activity level and climate. If you find it hard to drink enough water, try keeping a water bottle with you throughout the day or setting reminders to take a sip every so often. There are also some drinks that can negatively affect your hydration and prostate health. Coffee, alcohol, and sodas should be consumed in moderation. Coffee and alcohol are both diuretics, meaning they cause you to urinate more frequently, which can lead to dehydration. Sodas, especially those that are caffeinated, can have a similar effect and often contain sugars or artificial additives that can irritate the bladder and prostate. While these drinks might seem like quick ways to quench your thirst, they can actually contribute to dehydration and worsen prostate problems in the long run. To stay hydrated and protect your prostate health, stick to water as your main drink. Herbal teas can also be a good option as long as they're caffeine-free. If you need a bit of flavor, try adding a slice of lemon or cucumber to your water. Staying hydrated isn't just about drinking when you're thirsty. It's about making hydration a part of your daily routine to support your overall health and well-being. Holding urine for extended periods may seem like a harmless habit, but it can actually lead to serious health problems, especially for the bladder and prostate. Many people delay bathroom trips for various reasons, such as being busy or not wanting to interrupt their activities. However, frequently holding urine can cause a range of issues that affect both short-term comfort and long-term health. When you hold urine for too long, your bladder becomes overstretched, which can weaken the muscles responsible for controlling it. This can lead to difficulty fully emptying the bladder when you finally go. Over time, this can increase the risk of urinary tract infections, UTIs, and bladder irritation. For men, this behavior can also affect the prostate, as the bladder and prostate are closely connected. Prolonged holding can contribute to prostate discomfort and may worsen existing prostate issues, such as benign prostatic hyperplasia, BPH, leading to more frequent bathroom visits and discomfort. Delaying bathroom trips can also cause a buildup of urine in the bladder, which can lead to more serious complications. If the bladder is consistently overfilled, it can push urine back into the kidneys, potentially causing kidney damage over time. This not only affects your comfort, but can lead to serious health issues that might require medical intervention. The longer you wait to go, the greater the risk of developing complications, which could affect your overall urinary health. A regular bathroom routine is essential for maintaining both bladder and prostate health. Listening to your body's signals and responding promptly to the urge to urinate is crucial in preventing strain on these organs. When you make bathroom breaks a priority, you help keep your bladder and prostate functioning properly, avoiding unnecessary pressure and discomfort. To prevent complications, try to establish a routine where you visit the bathroom regularly, even if you don't feel an urgent need. Avoid holding urine for long periods, especially if you're at home or in a comfortable setting. If you are out and about, take the time to find a restroom rather than delaying the trip. Staying hydrated also helps maintain a regular flow of urine, which encourages frequent bathroom visits and keeps the bladder in good shape. Taking care of these habits now can help you avoid unnecessary health problems in the future. Improper medication use can have serious consequences, especially when it comes to prostate health. Many people try to self-medicate or use over-the-counter drugs without consulting a doctor, thinking they can treat their symptoms on their own. However, self-medicating can lead to complications, particularly when it comes to conditions affecting the prostate. One of the biggest risks of self-medicating is that you might choose the wrong treatment for your symptoms. While some medications can provide temporary relief, they might not address the root cause of the problem. For instance, over-the-counter medications for urinary symptoms might mask signs of more serious conditions like benign prostatic hyperplasia, BPH, or prostate cancer. Using these medications without proper diagnosis can delay necessary treatment, making the problem worse over time. Medications, even those meant to help, can sometimes have an impact on prostate health. Some drugs can interfere with normal prostate function, causing side effects such as reduced urinary flow, bladder irritation, or even worsening prostate symptoms. For example, certain medications used to treat high blood pressure or depression can cause side effects that impact the prostate or urinary system. Taking these medications without understanding their effects on prostate health can make existing conditions worse. Seeking professional guidance is crucial when it comes to managing prostate health. A healthcare provider can help determine the best course of treatment, considering your specific symptoms, medical history, and the medications you're currently taking. This ensures that you're using the right medications for your condition and that they won't interfere with other aspects of your health. A doctor will also help you avoid unnecessary or harmful drugs that could worsen your symptoms or lead to complications. Furthermore, improper medication use can lead to dangerous drug interactions. Some medications, when taken together, can cause adverse reactions that affect not just the prostate, but your entire body. For example, combining certain prostate medications with other drugs like blood thinners or antidepressants can lead to side effects such as dizziness, low blood pressure, or an increased risk of bleeding. These interactions can make managing your health more difficult and potentially harmful. Proper medical supervision is vital for ensuring that you're using the right medications and monitoring their effects. Your doctor can provide regular checkups to assess how well your treatment is working and adjust it if needed. With their guidance, you can avoid the risks of self-medication and ensure that your prostate health is properly managed, preventing complications and supporting long-term well-being. Extended sitting can have negative effects on prostate health, which many people may not realize. While sitting for short periods is generally fine, sitting for hours at a time without movement can cause circulation problems and increase pressure on the pelvic region. Over time, this can contribute to discomfort and potentially affect prostate health. Prolonged sitting puts pressure on the prostate and surrounding areas, reducing blood flow to the pelvic region. Poor circulation can lead to a variety of issues, including swelling and discomfort in the prostate. When blood flow is restricted, it can also affect the bladder, making it harder to empty fully. This can result in frequent bathroom trips, irritation, or difficulty urinating, which may be signs of prostate problems. Regular movement is crucial for maintaining prostate and pelvic health. Taking breaks from sitting and moving around helps increase circulation, reduces pressure on the prostate, and keeps the muscles in the pelvic area active. When you sit for long periods without moving, muscles become stiff and circulation slows down, which can worsen existing issues like benign prostatic hyperplasia, BPH, or cause new problems to develop over time. To improve your prostate health, it's important to make movement a part of your daily routine. Even small breaks can make a difference. Try to stand up and move around every 30 to 60 minutes. This doesn't mean you have to engage in intense exercise, but simple actions like standing up, stretching, or walking around for a few minutes can improve circulation and relieve pressure on the prostate. Walking and light exercise have specific benefits for prostate health. Walking, for example, is a low-impact activity that encourages blood flow and strengthens the muscles around the pelvis. It can also help with overall well-being by reducing stress and promoting a healthy weight, both of which are important for prostate health. Regular walking or light exercise also supports the body's natural processes, helping to maintain healthy hormone levels and reduce inflammation in the prostate. Incorporating these small movements into your day can help prevent the negative effects of prolonged sitting. By taking breaks, walking regularly, and staying active, you can support circulation, reduce pressure on the prostate, and improve your overall pelvic health. This simple change in your routine can make a big difference in maintaining prostate health as you age. Excessive alcohol consumption can have a significant impact on prostate health. While moderate drinking may not cause major problems, regularly drinking large amounts of alcohol can lead to a variety of issues, especially for the prostate. Alcohol is known to irritate the bladder and prostate, increasing the frequency of urination and potentially leading to discomfort or pain. For those with existing prostate conditions, such as benign prostatic hyperplasia, BPH, alcohol can worsen symptoms and make it harder to manage the condition. Alcohol can also interfere with medications used to treat prostate issues. Certain drugs prescribed for prostate health may not work as effectively when combined with alcohol. Alcohol can affect how the body processes medications, either reducing their effectiveness or increasing the risk of side effects. For example, alcohol can interact with medications for BPH or other prostate-related conditions, causing dizziness, low blood pressure, or digestive issues. It's important to be aware of these interactions and consult with a doctor before drinking alcohol while on medication. Another concern with excessive alcohol consumption is its dehydrating effects. Alcohol is a diuretic, meaning it increases urine production and can lead to dehydration. Dehydration can negatively affect prostate health, causing irritation and increasing the risk of urinary tract infections. When you're dehydrated, urine becomes more concentrated, which can irritate the bladder and prostate, leading to discomfort or pain. For proper prostate health, it's important to stay hydrated, and excessive alcohol consumption can make this difficult. If you're looking for alternatives to alcohol, there are many options that can help support your prostate health. Herbal teas, such as chamomile or peppermint, can be soothing and hydrating without the negative effects of alcohol. Water is always the best choice for hydration, as it helps flush out toxins and supports overall bodily functions. For those who enjoy a bit of flavor, sparkling water with a slice of lemon or lime can be a refreshing alternative. Guidelines for moderation are important for those who choose to drink alcohol. If you want to protect your prostate health, it's best to limit your alcohol intake to moderate levels. The general guideline is no more than 1 to 2 drinks per day for men. However, it's important to listen to your body and be mindful of how alcohol affects you. If you notice any negative effects, such as increased urinary discomfort or difficulty managing prostate symptoms, consider reducing your alcohol intake or eliminating it altogether. Excessive alcohol consumption can harm prostate health, interfere with medications, and lead to dehydration. By drinking in moderation and choosing healthier alternatives, you can help protect your prostate and overall well-being. Managing sexual activity when dealing with prostate issues requires balancing sexual health with the need to protect and maintain prostate function. For men experiencing prostate problems such as benign prostatic hyperplasia, BPH, or inflammation, it's important to consider how sexual activity can impact the prostate and overall well-being. Sexual activity can affect prostate health, especially if there is existing inflammation or discomfort. Frequent or intense sexual activity may increase inflammation or irritation in the prostate, causing discomfort or aggravating symptoms. This is why moderation is key. While it's important to maintain a healthy sexual life, being mindful of how often and how intensely you engage in sexual activity can help prevent unnecessary strain on the prostate. Moderation doesn't mean eliminating sexual activity altogether. It simply means listening to your body and understanding your limits. Overexertion during sexual activity can worsen symptoms such as pain, frequent urination, or difficulty urinating. By pacing yourself and being aware of your body's signals, you can maintain sexual health without overburdening the prostate. It's also important to seek medical guidance when dealing with sexual health and prostate issues. A doctor can provide advice on how to manage sexual activity alongside any treatments you may be undergoing for prostate conditions. If you're taking medications for prostate issues, such as those that reduce inflammation or treat BPH, your doctor can inform you how these medications might interact with sexual health and activity. They can also offer personalized advice on how to keep your prostate healthy while maintaining an active sexual life. Communication with partners is essential in managing sexual activity with prostate issues. Being open about any discomfort or changes in sexual health can help partners understand and support you better. Having honest discussions about any physical or emotional challenges that arise due to prostate problems can reduce stress and create a more comfortable, supportive environment for intimacy. Ultimately, managing sexual activity while dealing with prostate health concerns is about finding balance. By moderating your sexual activity, seeking professional guidance, and maintaining open communication, you can continue to enjoy a fulfilling sexual life while protecting and supporting your prostate health. In conclusion, taking care of your prostate health is crucial, especially as you age. We've discussed the importance of listening to your body's signals, staying hydrated, avoiding excessive sitting, and managing alcohol intake. It's essential to maintain a balanced approach to sexual activity and seek medical guidance when necessary. These steps, along with proper medication use, can help support your prostate and overall health. Being proactive in managing your health and seeking regular checkups can make a big difference in preventing complications and maintaining a good quality of life. The key to prostate health is staying informed, making mindful choices, and staying engaged with your healthcare provider. If you found this video helpful, please like, comment, and subscribe for more valuable content. I'd love to hear your thoughts and experiences in the comments, so feel free to share any tips or questions you have. Stay healthy, stay proactive, and thank you for watching.